In a recent report, it was revealed that 350 Americans died from COVID-19 in just 1 week, which, although significantly lower than the peak numbers seen in January 2021, is still a concerning indicator that the virus continues to pose a threat. Health experts have emphasized that the people who are still dying from the virus are largely from high-risk categories, particularly the elderly and those with underlying health conditions. Despite the public perception that the pandemic is over, COVID-19 remains active, and for some individuals, particularly the vulnerable, it continues to be deadly. One of the major contributing factors to these recent deaths is the decline in vaccination rates across the country. According to the Centers for Disease Control and Prevention, CDC, during the 2024-25 season, only 23% of adults and 13% of children received the updated COVID-19 vaccine. This drop in vaccine uptake has left many people without the protection they need to fend off severe illness, especially as immunity wanes over time. Experts have pointed out that this decline in vaccination is dangerous, particularly for older adults whose immune systems naturally weaken with age, a condition known as immunosenescence. These age-related changes in immunity, combined with common chronic illnesses found in people in their 70s and 80s, make them more susceptible to severe infection and complications. Another issue contributing to the death toll is the lack of timely and effective treatment. In many instances, individuals may not recognize the severity of their symptoms early on, or they may not have access to proper care, which allows the infection to progress unchecked. Moreover, the appearance of new variants, such as the recently identified subvariant NB.1.8.1, has raised additional concerns. While it's still under observation, its spread could be part of the reason for the increasing number of infections, which in turn could lead to more deaths if proper precautions aren't taken. Experts are urging the public and health authorities to remain vigilant. Although the overall number of deaths is much lower than during the peak of the pandemic, the ongoing loss of lives is a clear reminder that the virus is still with us. To prevent further loss, they advocate for higher vaccination coverage, better access to treatment, and continued monitoring of emerging variants. Even though the world has moved on in many ways, COVID-19 continues to take lives, particularly among those most at risk.